Yeah, thank you, John, and sorry about that. Can you see my slide? I was trying to share my slide.
Yes, we can.
Okay.
Looks good. You might want to go to full screen. You might want to go to slideshow. There you go.
So is that duplicating, or?
That looks fine.
I can. Is that better?
Much better. Perfect.
All right. Thank you very much, John. Okay, I'm going to, following the presentation from Shalini and John, I'm going to go over the studies and the progress of the vaccination of the birth dose in the WHO region. So this is the outline of my presentation. Just going to give you a background, some studies, and then touch a little bit upon the challenges and the way forward for the region. So as John mentioned earlier, there are over 250 million people that are infected with chronic viral hepatitis in the world. And almost 1/4 of those people are living in the Afro region. And you can see that on the map on the left side, where we have about 60 million of people that are chronically infected. And on the right side, the graph is just showing that the Afro region is only second to the Western and Pacific region in terms of number of people infected with chronic hepatitis B in the world. Now, when we come to the burden of the viral hepatitis B among children less than 5 years of age, which is most of interest for us in immunization, there are 16 countries in the world that account for more than 80% of the number of 80% of the number of children infected with chronic hepatitis B. And among those 16 countries, 9 out of them are from the Afro region. And you can see them highlighted on the graph on your left side with the stars. And as you can see, Nigeria is the country where we have the highest number of children infected with chronic hepatitis B in the world. And the map on your right side is just showing you the prevalence, the current estimates of the prevalence of chronic infection among children less than 5 years across the globe. And as John mentioned earlier, Afro region is the only region right now that has not reached the threshold of less than 5% prevalence in children less than 5 years of age. So the region is currently at 2.53% prevalence. So that's work that is still showing how the work we still have to do ahead. Now, back in 2016, the regional committee for the region, they endorsed a target to control hepatitis B in the region by reducing the prevalence to less than 2% among children less than 5 years of age. And to reach those targets, additional targets were endorsed. And the first one was to at least increase the number of countries that have the birth dose up to at least 25, because back then there were only 9 countries that had the birth dose. And on your right side, on the right column of the table, you can see the studies where we are. Right now, we have actually 14 countries, so far short from the 25 countries that we're targeting. And the other target was to have at least 50% coverage with the hepatitis B birth dose among newborns. And currently, as you saw earlier in the slide that Shalini showed, the timely birth dose coverage in the region is about 6%. And when it comes to achieving at least 90% coverage of the third dose of the vaccines among infants, we are currently at 73%. So the last thing is just to show you that we are still behind. We didn't meet our own target that was achieving less than 2% prevalence of chronic infection among children. Now, when we look at the progress, how we progress over the last 20 years in the regions with regards to vaccination. When we look at this graph, we'll see like in the red line representing the third dose of hepatitis B vaccine, and the blue line representing the birth dose. As we can see, most of the countries have started introducing the hepatitis B vaccine in their schedule, mostly as mostly in combination with other antigen, most commonly known here in the region as pentavalent. And by 2009, all the countries have introduced this vaccine into the infant routine, either in 6, 10, or 14, at 6, 10, and 14 weeks, or 8, 12, and 16 weeks. And as you can see, once we get all the countries on board with the pentavalent, the coverage increased up to quickly to the 70%. But as you can see, in the last 10 years, the coverage has been stagnant, and we still are 73%. As for the birth dose, as you can see for the birth dose, there has not been any progress. Not many countries have taken it. And currently, we are still at 6% of coverage in the region. And it's important to notice here that when we talk about birth dose coverage, is the timely birth dose coverage, meaning that it's the those that are given within 24 hours of birth. And that's posed a little bit of challenge in our region. And this graph is trying to highlight it and show where we stand now. As I said before, the uptake for the birth dose introduction has been very slow in the region, because by 2000, we had about 3 countries that have introduced the birth dose. It quickly went up to added 4 countries up to 2007. But for 10 years after 2014, almost 10 years, there have not been any progress in the introduction of the vaccines. It's only in 2013 that we see a little bit again in progress going a little bit towards introducing, but that's also very slow because it's coming maybe 1 country at a time per year. And currently, up to 2019, we had 13 countries, and 2020, we had an additional country that introduced the birth dose in the schedule. Now, this graph is just to show you the introduction per year by country. As I said, as of now, we have 14 countries that have introduced. And you can see that on the left side, the country in the year of introduction. And here we just highlighted Mauritius in yellow, in green, sorry, to just indicate that among those 14 countries, that's a country that is providing targeted vaccination. They only provide the vaccination to the kids whose moms are tested positive. The other countries are providing universal birth dose. They provide it to every child that is born in the country. And now on the right side, the map is showing the actual coverage of all combined birth dose vaccination in the region. And when I say that, this is including the timely birth dose, as well as the doses that we're giving after the 24 hours. And you will see that if we look at it, the coverage in the region, we'll see that we have among the 14 countries that have the birth dose, we have up to 4 countries that are over 90% coverage. And when we look at the countries that have, and those are highlighted in green on the map, and we also saw that the rest of the countries basically have a coverage of more than 50%. If we look at all vaccines given. We only had 2 countries that have less than 50% coverage when we look at the overall. But the caveat here is like, the reality is like those countries are the countries that have newly introduced the birth dose in their schedule, and are Cote d'Ivoire and Equatorial Guinea. And basically for Cote d'Ivoire, they even introduced it towards the last trimester of the year. So the coverage is still very low because this is data for 2019. Now, what are the common barriers that we have faced here in the region for the introduction of the birth dose? There are several assessments and surveys that were done by WHO back in 2016. And also, I think Gavi also did a survey. And what came up most commonly on those surveys is really the lack of funding, because the vaccine is not funded by Gavi. As you all know, Gavi is the organization that is funding, giving funding to vaccines in most countries in the region. For the birth dose, because the vaccine was cheap, it wasn't really supported by Gavi. So a country was mentioning that as a major barrier for them to be able to be able to support the cost of the introduction, as well as even buying the vaccines to be able to sustain the vaccination. And another barrier that also came was the birth taking place outside of health facility, because they were wondering how can we reach those children, those newborns within 24 hours and make sure we give them the vaccine within the time frame recommended. Also, we had like issues around vaccine storage and cold chain limitation. Specifically, if you go away to the rural areas, they know that now with this platform, most likely we have to bring some type of cold chain in the maternity wards to have the vaccination, and that was creating some kind of limitation. Another point that also came that is important is really the lack of or insufficient data on the burden of the disease itself in the region. So it was creating some type of question on how do we really need to introduce why do we really need to introduce the birth dose? And another issue also that was brought is the lack of national immunization technical advisory groups in the region to be able to advise the country and make recommendations, look at the evidence and make recommendations to the countries for the introduction of the vaccine. And another point that came up was really Gavi support, but as I already mentioned that at the beginning, and specifically because in our region we have up to 38 countries that are eligible for Gavi funding, and they're actually funded by Gavi out of 47 countries. Now, for the countries that have introduced already the birth dose, now there are also challenges on how in the delivery, because as we saw, we need to have the vaccine delivered within 24 hours. Those are even the data that are reported globally, because for now, the vaccines that are given after the 24 hours are not really reflected in the global coverage that we saw. So one of the biggest challenges in the countries that have introduced the birth dose, and that's data, those fundings come from multiple assessments that were done in about 7 countries in the region. And one of the biggest issues was the coordination between the maternal and newborn and child health and the EPI services. Because as you know, this is a different platform than the usual platform used in EPI for vaccination. So because in this situation, normally the vaccination it's recommended that the vaccination take place into the maternity or in the maternity ward, and to make sure we get it done within 24 hours. But when even the vaccine is even done in the maternity ward, the other thing we have is now the documentation. How do we make sure we have a good coordination to have the doses that are given documented in the maternity ward and be transmitted correctly to the EPR service to report. And the other issue was the out of facility and home birth. Because I mean, in the countries that we did the assessment, there is no really outreach vaccination services for women that is delivering at home. And the standard is to ask them to come back to the facilities to be able to get the postnatal care. And that's where maybe we take the opportunity to vaccinate the kids. So that makes a big challenge to even get a timely birth dose given on that thing. And in some of the countries, we also find that there were a lack of written policies and guidelines to deliver the birth dose. And even if that was done at the national level, when you go down to the lower level, sometimes those things are missing. It's not really well disseminated. And we also notice some type of gaps in healthcare workers training. And I mentioned before the cold chain in rural areas. That was also an issue. And also, I mean, just to mention, and I think Shalini mentioned that before, it's good to even bring COVID-19 pandemic response, which has disrupted immunization services. We don't have data yet to know exactly what impact it has, but by the end of this year, we'll have a better sense of the disruption created by the COVID pandemic. So what's the way forward? For us, the way forward will be like building a community to support the birth dose and production in the region. It's exactly something like what we're doing now, like bringing together, for instance, this meeting. That's a good thing. That's a way forward we're looking for. And also, we want to also continue to support the generation of evidence, and evidence for what we can be doing some studies, like pilot study or study to demonstrate the mother-to-child transmission in the region that can really help to educate and really help to inform countries for the introduction. And we can also do like sero surveys, and the sero surveys we can do from, because sero surveys are expensive, what we're trying to push for is maybe to target to other kind of big surveys that are done in the country to help get the data. And we can note on that like the mix, the DH, the multi-cluster indicator, the multiple indicator cluster survey, the demographic and health surveys, and HIV impact assessment surveys. And also it's really coming to enhancing the NITAG capacity in the region, because like a lot of countries did not have NITAGs. They're creating, they're developing and establishing NITAGs now. So we need a lot of capacity building for those NITAGs to be able to take up the recommendation questions. And also the way forward is like, we know that now in Gavi 5.0 strategy, they're planning to support the birth dose vaccine. And that's a good news for us, and really looking forward into that, even though it has been delayed due to the COVID pandemic. So just for conclusion, I will just remind that the regions, we miss our target for the 2020. We only have 14 countries that have introduced. And as mentioned before, the coverage is very low, 73 for the third dose of hepatitis dose among infants and 6% in the birth dose. And for even the prevalence of children less than 5 years of age, the prevalence is still almost 3 times higher than the global prevalence. So we can note the persistent challenges to the vaccination, mainly first by even introducing the birth dose, the uptake in the country to introduce, and also even when it's introduced, is how to minimize the missed opportunities to make sure we can do the timely birth dose and increase the coverage. And also we can continue to generate evidence to support the introduction, because the country still needs that, and that's really welcome. And just to say that, to finish, is just to mention that that's why this type of meeting, like the stakeholder coming together, is very important. will come up together and find staff to really support and accelerate the introduction of the birth in the region. Thank you very much.
Thank you so much, Julien. Excellent overview. Really